Hello, everyone. I'm Arya, your host for today's session, and welcome to the FB Live, where we learn about some tips. So, how can one stay healthy in summer? Well, if you're Indian origin living in US, and if your parents are visiting from India, you don't need to worry about their medical needs in US. eGlobalDoctors has your back. They have different packages for you, starting from $199 that provide you access to 300 plus doctors from USA and India with 30 plus specialties. Prescription will be provided and they get back to you within 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world. Video consultation is about 30 minutes and in-app messaging with doctor after consultation and ID and portable health passports are available. Visit www.eglobaldoctors.com and register yourself now. In today's FB Live session, we'll be exploring and providing more information about how one should take care of their health in these harsh summers. So we have with us today Dr. Umesh Sharma from Arizona, USA. He's an internal medicine physician with 16 years of experience focused on hospital-based care in collaboration with medical and surgical specialties as required. His interests being in perioperative medicine, CHF, and renal failure. He has residency in internal medicine from Vail Medical College of Cornell University at St. Barbara's Hospital, Bronx, New York. Welcome to today's session, Dr. Sharma. How are you doing this evening?
I'm doing okay, Arya. Thank you so much for this invite. It's a pleasure to be back on eGlobalDoctors, and thank you for all the good work you've been doing, not just the pandemic, but even after the pandemic.
Pleasure to have you on live, Doctor. So the summers are getting very hotter each passing year with this blazing sun, and taking care of our health in such a hot weather has become very important these days. So with our topic being all about sharing tips to stay healthy during summers, let's dive right into our very first question. So what are some potential health problems that one can encounter in this hot weather?
Good question. So as we all live in Northern Hemisphere, we have summer. And I'm sure you've seen over the years, the summers are getting harsher and harsher, getting hotter and hotter. But it's in Phoenix, Arizona. It's kind of desert here in the US. I'm sure it's the same in India right now with the peak of summer. So obviously you have heat-related problem. At the same time, a lot of people tend to travel. It tends to be the non-school year. People have vacations, they travel. So there's always this risk of travel-related illnesses. So regarding heat problems, depending on how much you get exposed and the intensity of sunlight, and if you're using protection or not, you may be exposed to a range of problems, including just minor heat rash, which we call in Hindi ghamolia, ranging from that to sunburn, then heat cramps, heat exhaustion, and the fatal is heat stroke. So there's a spectrum of range of possibilities with heat exposure. So heat rash, as you know, is just when you get mildly exposed to sun, you get little not necessarily blisters, but little kind of papules, lesion on your skin, and it's very itchy, very painful. And the treatment is obviously you get outside the sun, get away from the sun, use a little topical creams, something that will soothe your skin, like aloe vera. Sometimes people use Benadryl, or a little spray of like a numbing medicine, or even like little cooling powder that helps. The second is the heat, like a sunburn. It's like your skin literally gets burned because of sun's rays. In that case, you basically do the same thing, avoid exposure to the sun, and try to use topical creams, numbing medicine. And typically, if it's a blister, you don't want to burst the blister, and things should get better. And the next one, the heat cramps and heat stroke, as well as heat exhaustion. We'll talk a little bit later on about it. Regarding travel, people travel, you get exposed to different people, different environments, food, water changes. There's always risk of diarrheal disease, infectious disease when you travel, and not to mention COVID. So those are things which are likely when you travel, when you get exposed to heat as well in the summer.
Right. So you mentioned heat stroke, heat exhaustion, and cramps or sunburn and heat rash as well.
Mm-hmm.
So how to manage these heat symptoms? Like, how do I know I have any of that?
So the biggest thing is, you have to realize the symptoms, right? So for example, if it's a minor thing like heat rash or sunburn, it is really mild, typically is not life-threatening. but heat exhaustion and stroke can become life-threatening. So as I said earlier, the more you get exposed, the higher the intensity of sunlight, the less protection you have, the more likelihood of you getting in trouble. So starting with heat cramps. So if you're working outside, especially people who are exercising in outdoors in hot weather, and you don't drink as much water or you're running low on electrolytes, your muscles can cramp up, and that's something called heat cramps. And then the next after that is heat exhaustion. When you get exposed to heat a little longer than necessary, then what happens is your body tries your best. One of the mechanisms we have to cool ourselves is sweat. So every time you get heated, your body releases more sweat. You have water on your body, the water cools, the temperature goes down. And usually the more you sweat, especially you lose a lot of electrolytes and fluids, and you get heat exhaustion where you get cold, clammy, you get maybe your heart rate may raise, you get dizzy, sometimes confusion. So that's heat exhaustion. And if you don't do anything here and you still get exposed, eventually what happens, your body's defense mechanism, the way you cool yourself, gets completely exhausted. So your body cannot cool you down anymore. And then what happens is your body heats up and your temperature goes above 40, 41, 42 degrees Celsius. Your body gets red, hot, flush, your heart rate goes up. Again, at that stage, you're at risk of everything shutting down, especially getting confused. Sometimes people get seizures, people get comatose, and there's always a risk of dying as well. So that's a really a risky situation where you really want to come back and cool somebody as soon as possible, as fast as possible.
Those are some really good tips that you shared. But then who are at high risk for these heat-related illnesses in particular?
Sure. So before I answer that, let me just go back a little bit more on. So typically, if you see somebody who's getting heat exhausted or having heat stroke, the biggest thing, as I said earlier, is to have the body temperature drop down as fast as possible. Number one is so if you're getting exposed to sunlight, move people out of that sunlight, move to a cool shaded area. If possible, somewhere there's air conditioning. If that's not possible, try to lower the body temperature as fast as possible by dumping cold water, whether it's through bucket or sponging or showering or just spraying somebody with cold water. If that's not available, the easiest thing to do is get a bed sheet, just basically drench the bed sheet in cold water, apply that on the person, and use cooling fans to bring down the temperature. Drinking cold water helps. Obviously, if somebody is comatose or in a really tough shape and doesn't look good, you obviously want to get medical help right away. Call the nearest hospital because these folks are at high risk of deteriorating. They need expert medical advice and treatment, including sometimes ICU care and hypothermia treatment type stuff. Having said that, people who are at high risk of getting heat injury are usually people at extreme ages, the infants and the elderly, where the body heat regulation is not as robust, or they don't have access to fluids as much as the average adult does. Somebody who has active medical disease like prior heart disease, kidney disease, prior strokes, obviously they are at risk of getting more exposed and more problems with heat exposure. If you're getting medicines like water pills, you're already dehydrated. On top of that, if you get exposed to sun, you might lose a little more water. So those are at high risk of getting symptoms. At the same time, people who are other medications like psychotropic or people getting benzodiazepines or tranquilizers, those are also at risk of getting sunstroke.
Okay, so maybe the children or people who are like 60 plus who are physically unwell should be taking more care of their health. They are at the more risk, right?
Correct. So the bottom line is prevention is always better than cure, right? The best thing you want to do is to avoid heat, especially when it's really, really hot, and especially the hottest hours of the day, typically from 12 to 3, 4 o'clock. That's when the sun is at the highest level. It's very hot. That's the time you really want to avoid going outdoors unless you really, really have to. If you decide to go outdoors, then you want to minimize how much time you spend outdoors. At the same time, there are certain things, common sense stuff you can use, like loose clothing, which will promote aeration. You want to wear like sunscreen with at least 15 SPF, sun protection factor or more. And especially look at the sunscreen, which is blocking both ultraviolet A and B rays. You want to wear like big hats with little shade. Obviously, you want to space out. So if you're working for a couple hours, take good rest in between. Make sure you're hydrated, especially if you're sweating. Make sure you replace not just water but also electrolytes. One of the cheapest thing to do is to get a glass of water, a spoon of sugar with a pinch of salt, just like the oral rehydration solution that's been promoted back in India. That's the cheapest way to get electrolytes. Obviously, if you can afford or if you have the option, use Gatorade or something that's more balanced electrolyte solution. That's also an option. Especially if you're going to go hiking or spending a lot of time outdoors, tell somebody, hey, look, next couple hours I'm going to be outdoors hiking. Can you check on me in an hour so somebody can watch you? And especially this is more common in America. Is if you're driving a car and leaving a car parked in a parking lot, make sure don't leave young kids in the car, don't leave pets in the car, because they are really at high risk of hypothermia and death. There are reports, unfortunately, every year in America where people forget. You'd be surprised, people forget their kids or their animals, pet animals in the car, and they obviously succumb to the heat injuries. So those are a couple of things just to be mindful of what you can do to prevent heat injury, not only yourself, but also your loved ones.
Absolutely. So when we are on the topic of this heat exposure related health problems, you mentioned about the heat stroke that should be something we should be avoiding completely. I know you explained it a bit earlier, but I would like to stress it more because it's very important. So what exactly is heat stroke for anyone who has no idea about it, and what are the symptoms of warning signs of it?
So thanks for, again, you're right. This is something which we have to be very, very cognizant about, and nobody should ever reach the point where somebody, it ends up in heat stroke or death. So as I mentioned earlier, as your body heats up, the body, you kind of see the effects. So what happens, your body temperature goes up, typically above 40 degrees Celsius. Your skin gets hot, flush, red. Your heart rate starts going up. You get dizzy. Obviously not sweating because your sweating mechanism has failed you. So your body's warm and flush. And then at the same time, you start getting confused. Sometimes people get seizures. Sometimes people get comatose. You kind of lose consciousness. So those are the symptoms. So if you see somebody having these symptoms, they look hot, flushed, confused, they may be having a heat stroke. And the treatment for that is rapid cooling. Rapid cooling, bring the temperature down as fast as possible. Typically, if somebody's at that stage beyond heat exhaustion, you definitely want to get medical help if available right away. If not, do your best to cool somebody down as fast as possible with the methods I mentioned earlier, lowering the body temperature with cold water, hosing somebody down, taking a cold shower, putting them in a cold water tub, mopping them down with cold water, ice water, and try our best to lower the temperature down below 40 degrees as fast as soon as possible.
So watch out if you are in the sun for a long time and experiencing throbbing headache, dizziness, or high body temperature, you might be having a heat stroke. And the solution to it,
No, go ahead, sorry.
Yeah, go ahead.
So you're right. If you start getting those symptoms, you might be starting with heat exhaustion and reaching towards heat stroke. Typically, if you at the point of heat stroke, is a little too late to kind of get back. So the bottom line, if you start feeling that yourself or you see somebody doing it, pull them out of the heat, pull them out of the sun, bring them to a shaded area and start active cooling right away.
Absolutely. Okay. So there can be a possibility that people would take medications to avoid catching these problems. So does that help, or do medications increase the risk of a heat-related illness?
As far as I know, I don't think there's any medication that prevents heat stroke. As I said earlier, the prevention is the best cure. On the flip side, there's certain medication that may predispose you to be exposed to heat and then side effects. For example, the psychotropics, people who have behavioral issues or psychotropics, some of those it may prevent you from realizing that, hey, I'm getting exposed to sun too much. Sometimes if you're anticholinergics, some medications have cholinergic side effects. So like people with Parkinson's medication that may prevent you from sweating. So that also predisposes you to heat stroke. The people taking tranquilizers, benzodiazepines, anything that'll blunt your response to external stimuli can predispose you. Obviously, diuretics, anything that reduces your volume of water in the body, makes you prone because you're already dehydrated. And then on top of that, you start losing water. That's going to predispose you for alcohol. A lot of people, if you're sometimes outdoors, may enjoy and drink alcohol. Typically, drinking alcohol is a risk factor for heat-related illnesses as well. So something to think about. If you're rehydrating, try to avoid alcoholic drinks when you try to hydrate yourself.
Okay, I wasn't aware of that. Thank you for sharing this piece of information. So we have heard that staying hydrated in summers is important, but how much fluid should someone drink? Like how much amount is appropriate?
So usually, normally on a normal condition, the recommendations are to at least minimally drink, 1.5 liters to 2 liters, roughly. If it's hot, you obviously want to drink much more. The bottom line is don't wait until you are thirsty to drink water. Make sure you're hydrated throughout the day. The easiest thing to do is to look at your urine color. If your urine is really getting dark, yellow, or orangish, it's concentrated, it means you need water. Ideally, urine should be very light yellow. So as long as light yellow, you're hydrated. That's the easiest thing. The other thing to look at, see your tongue. If your tongue is feeling dry, your lips are feeling dry, you might be dehydrated as well. So those are a couple of easy things to remember on how to hydrate yourself. But the bottom line is be mindful, with understanding that it's just hot, you'll be sweating, and you'll have to just keep hydrated and staying on top of hydration.
Right. So these summers are the happy season for children because they do have big summer holidays, and families do prefer to travel or go for a picnic or a holiday spot. So how to stay safe during these travels and not catch any heat illnesses?
The biggest thing is, you have to just be careful. You cannot not travel, right? But at the same time, say if you're traveling with an airplane or bus or train, and you see somebody who's obviously sick, somebody who's coughing, somebody doesn't look good, try to stay away from them at least 6 feet. If somebody's coughing, obviously, it'll be nice if they wear a mask. If they are not wearing a mask, at least you can wear a mask, especially in a tight, crowded situation. So personal hygiene, like hand hygiene, hand washing, masking would help. Obviously, staying away from people who are sick. And especially if you're eating outside, try to be aware, mindful of what kind of hygiene is that person or that business is offering you. If you obviously see hygiene issues, then try to avoid food there or water there. It may not be better to carry your own personal source of water if you're traveling and being outdoors. And last but not the least is vaccination, especially if you haven't had your COVID vaccination. Make sure you get your COVID vaccination. I think it's beyond the flu season, but typically that's something you want to do as well, is take your flu vaccine or the appropriate vaccination when necessary.
Great. So all the precautions we were taking when it was the severe COVID period times, we should definitely continue to do that. So maintaining hand hygiene, washing hands, wearing masks is all that is going to help you.
Correct. Unfortunately, COVID is still there, and it's probably dormant right now. But you obviously you hear the stories where there's another variant in here and another variant there. So just be mindful that you never know, it can creep back again. My hope is it doesn't. We already had 3 variations. Hopefully there's nothing as bad as before. And hopefully there's enough people who've taken some kind of vaccination, so there'll be enough protection to prevent people from getting another pandemic. But again, you never know. There's a lot of unknowns with COVID. So that's at least the least you can do is to be cognizant and do the best you can to protect yourself from infections.
Absolutely. So it's a wrap. Thank you, Dr. Umesh, for providing such a helpful session with so much of details. And with that, I'll be taking your leave. Stay indoors as much as possible. If you ever need to go out in this hot sun, don't forget to apply proper sunscreen, cover your face to avoid any type of heat rash, and stay hydrated throughout the day. I'll see you in the next session. Till then, take care and stay safe. And yes, don't forget to visit and register at www.eGlobalDoctors.com. Thank you.
It is now possible to have the most experienced, highly qualified and compassionate doctors at the click of a button. eGlobalDoctors is a user-friendly, secure mobile and web application through which you can have affordable online healthcare consultation and speak to the doctors from the comfort of your own home. You can now avoid traveling long distances to reach the doctor and avoid long wait times. You can now do a video call to eGlobalDoctors physician with the ability of family members to join from different parts of the world. Every user of the platform can have Health Passport, a personalized and secure hub for all of an individual's electronic health records, which includes prescriptions, doctor's reports, and lab reports, with ability to access from anywhere in the world. eGlobalDoctors' second medical opinion is performed by our board-certified and senior doctors, bringing you the world's latest and best health care. We can help patients to get the necessary treatment done at a place closer to them by leveraging our network of doctors who share our vision and values. eGlobalDoctors addresses an individual's medical, surgical, pharmaceutical, and ancillary healthcare needs on one platform at the fraction of the current cost. eGlobalDoctors is one complete healthcare platform solution for all your medical-related issues and questions. Our goal is to provide unbiased and honest medical opinion. We are available 24/7. Please visit us at eglobaldoctors.com.